So over the last 24 hours, we saw 5 new cases, and we are currently tracking 32 cases across the country. We have 2 persons in the hospital right now. The cases right now, it's in all the regions, and it's based on how many persons are coming forward to be diagnosed. So over the last 24 hours, we did 303 tests, and of those 5 came back positive. In terms of booster doses, we have administered close to 76,000 booster doses. We're not seeing a lot of people coming forward to get booster doses, and that's something that we want to encourage. The ministry has launched several programs. We have a night program now, so people coming off of work, and if they're interested in getting the COVID vaccine, they can come to the tarmac here in Georgetown and be able to get the booster doses. But these centers work throughout the day, and we just want to encourage people to make sure that they get their booster doses. While we have centers in Georgetown, we also have vaccination centers across the country, and therefore there's no excuse why someone should not get their booster shot. So polio is an infectious disease that affects the spinal cord, and it can also affect the brain. And when it does affect these neurons in the spinal cord, it can result in paralysis. So the limbs, people would have difficulty using their limbs, and that has been one of the notable features of polio in the past. But because of this, the Pan American Health Organization had launched a campaign to eliminate polio in the Americas. And then in 1988, another program was launched by the WHO to have global elimination. And this was done because we were able to manufacture cheap vaccines, what is called oral polio vaccines. And the vaccine, they had 3 components to it. So it was called a trivalent oral polio vaccine. And that was what was used throughout the world to help to eliminate polio. I think traditionally people think about a vaccine that you get in your arm, but in this case, the vaccine that was used was a drop, and you put it in the child's mouth. And so by doing that, that child would have been immunized. It was a trivalent vaccine because it was targeting 3 different types of polio virus: type 1, type 2, and type 3. And then by administering this over a number of years, the type 2 of the polio virus was eliminated around the world. And so the scientists thought that it didn't make sense then to include something that was eliminated. And so the vaccine was changed from a trivalent vaccine to a bivalent vaccine, meaning targeting the 2 circulating polio viruses, which was type 1 and type 3. And so that was what we've been using. But it was also found that if you continue using this, it might not have the same efficacy as if you vaccinate someone using an injection. And so it was recommended that we change the way that we immunize children. So instead of oral polio vaccine, that we use the inactivated vaccine, which is normally injected. We have made that switch. We have actually eliminated polio. We don't see polio cases here. And that's because we have a very robust vaccination program. So in 2017, for example, using the IPV vaccine, type 1, we had 94% coverage. In 2018, we were at 94 again. In 2019, it went up to 97. And in 2020, it dropped because of COVID. It went down to 91. And then in 2021, we have been able to increase that to 98%. We have introduced IPV2, that's inactivated poliovirus 2, vaccine 2. And that was introduced in 2019. And at the time when we introduced it, we were at 97% coverage. Again, we had seen a dip in 2020, which was about 91%. But in 2021, we had been able to increase that to 97%. So I think for both IPV1 and IPV2, at 98 and 97%, that's very extensive coverage. And we'll continue to maintain those numbers. Well, we were pleased to welcome the director of the Pan American Health Organization, Dr. Clarisse Etienne, who came to Guyana on the 23rd. And during her stay, between the PAHO local office and the Ministry of Health, the government of Guyana, there was a number of activities in which she took part. She met with the president and had some discussions pertaining to collaboration between the Pan American Health Organization and Guyana. We also had a tree planting exercise at the site of the new maternal and pediatric hospital to mark PAHO's 120th anniversary. This year, PAHO would be celebrating 120th anniversary. So we were able to do that with a tree planting exercise. And then we had a very intensive meeting with her and the directors of the Ministry of Health to talk about collaboration in various aspects of public health. And we touched on surveillance, we touched on infectious diseases, chronic non-communicable diseases, regulations and laws that we need to put for public health, new technologies that we need to deploy so that we can improve health across the country. So there was a very wide-ranging discussion, and she felt that there are many innovative things that are happening in Guyana, especially in the area of primary health care, and she would like other countries to come and visit Guyana because there are many best practices and people from other countries can learn how we have been able to successfully implement some of these programs. So we were very open to allow persons to come and to share our experiences with them. And hopefully in the near future we'll start documenting more of this type of experience so that other countries can benefit as well. We also signed a strategic note which mapped out the areas in which Guyana and PAHO would be collaborating over the next 5 years. And some of the things that I already touched on are included in that note. So we look forward to a more intensive collaboration over the next 5 years because there are lots of other things that we like to do in the area of public health. And PAHO has a lot of technical expertise, and we are going to leverage those experts to help us to develop a better healthcare system here in Guyana.